Hi guys, I'm Latasha, co-owner of Divine Organics, and today you guys are here with us for Cancer Tip Tuesday, and we're going to be going over questions that you ask your oncologist following treatment. The number one question is recurrence. Of course, that is the main concern that everyone has on the chances of their cancer coming back. So make sure you discuss that with your oncologist so that you know how to plan ahead. The next thing is follow up. You need to know when to schedule a follow up, what diagnostic test that needs to be completed, how often, that sort of thing, because you need to keep a handle on, your testing. The next thing is side effects. Some side effects are short term following treatment, and some side effects are long term. They don't show up until, years after you've completed your treatment. So you do need to know, what to expect. And it's different for everyone. The next thing is your diet, your lifestyle changes. You need to know as far as your nutrition, what you need to eat. Of course, fruits and vegetables, green leafy vegetables are always good. Try to stay away from GMO products if you can. And again, everything is different for everybody. So please talk to your oncologist about that and try to be as healthy as you can. The next thing is medications. You need to know what medications you can and cannot have. And also, you may have to take a medication for the rest of your life. Some breast cancer patients are, taking a medication for the rest of their life, and you need to know what to expect so that you can mentally plan ahead and also financially plan ahead. The next thing is who you should contact if you have any symptoms. Of course, if you're having any nipple discharge, if you're a former breast cancer survivor, if you see or feel any lumps, bumps, anything, you need to know who to contact. And of course, I think you will call the nurse line and tell the nurse your symptoms, and she'll, talk to the physician, and he'll see if you need to come back in. The next thing you need to know is when you can return to work, start back exercising, travel. Again, it's different for everyone. Talk to your healthcare provider about that. And the last thing is, I'm reading, guys, okay? Support resources. So depending on where you live, there's different resources available to you. I know we participated in the Art Brawl of Austin, and because we're in Austin, Texas here, and we learned about the Breast Cancer Resource Center. Can you guys see that? So these guys are so awesome. They provide assistance to breast cancer survivors. So I think they help with like food. I don't know about co-pays. Just go to, here's the website, bcrc.org. I don't know if you guys can see that. And I think the Komen Foundation also has resources available. You can Google resources available for cancer centers in your area. Just know that you're not alone. If you cannot find anybody, send me a DM and I'll see if I can help. So just know that here at Divine Organics, we're here to help. And we also have products that are available to assist with your skin changes, to provide hydration. We have neuropathy cream that will help, because some people get tingling in their fingers and it's hard for them to return to work. So our therapeutic relief cream is great for that. If you have skin changes, we have daily moisturizer and facial cleanser that will help with that. So just send us a DM. If we can find a resource available to you, we can. Just know we're family.